Hello, my name is Dr. James R. Golding, and you're watching A Natural Healthcare Alternative, the program dedicated to your health, longevity, and well-being. In celebration of National Orthodontic Month, I decided to do a program on modern developments within orthodontic care. And boy, did I learn a lot. I started out and I was invited to visit a new state-of-the-art facility located on Prince Rogers Road in Bridgewater, New Jersey. And boy, has that field changed a tremendous amount. I remember when I was a kid, the only time that anybody went to an orthodontist was if they had like buck teeth or really, really bad teeth. Then their parents brought them to the orthodontist. Now, the field has developed to the point where it's not so much about bad teeth as it is about perfect teeth and a perfect reflection of one's emotional state by having good teeth. And as you'll see as we go along, having good teeth represents having good gums, represents having a positive attitude, represents TMJ and proper alignment of the jaw joint, as we'll be going through in a forthcoming manner. So I tapped the knowledge of a researcher and orthodontist that is in Bridgewater, and his name is Dr. Robert Sanford, and he's here with me on the show today. Dr. Sanford, welcome on the program.
Thank you, Dr. Golding.
And thanks for coming and spending some time with us.
It's a pleasure to be here.
Tell me a little bit about some of the more recent developments that have been going on in the field.
Most recently, and I'll take a time slot of, let's say, over the last 15 to 20 years, what has happened progressively in orthodontics is we've moved from the classic railroad tracks of stainless steel bands around every single tooth. It was really quite a chore and at that time rather painful to have everything put on at that time. We've moved to a state where we now have very streamlined brackets. We have brackets that are, as we can talk about in a few moments, that are made out of anything from stainless steel to gold-plated brackets to tooth-colored brackets that are made out of a ceramic. So we're really we're trying to suit the needs of all of our patients, from the very young children to our adult population. In the midst of the style of bracket that's changed, and that's the actual brace that fits on the tooth, instead of the stainless steel bands, the brackets themselves are bonded to the teeth with state-of-the-art adhesives. And the wires themselves have changed. Instead of being a stainless steel wire that has been traditionally rather stiff, all the parents always mention, oh, I remember that adjustment.
Or people being cut with them.
Yes, exactly. Now we're using to a great deal nickel titanium alloys. And the beauty of the nickel titanium alloy, briefly, is two. One is extreme flexibility. They are very, very supple, very gentle, which allows us to apply very physiologic forces, in other words, very
like
gentle forces.
Tensile strength to a greater degree.
Yes, and tensile strength has improved. But they've also given us a very unique opportunity with the nickel titanium. And that is, they've created for us, these companies that have produced them, and the idea originally came from NASA, as a matter of fact, is a temperature-sensitive wire. And what that means is these wires are actually sensitive to the temperature, where when placed in the mouth, where the mouth warms up the actual alloy, it becomes more springy. As it cools down, it becomes less springy. What that means to me is I can cool a wire down, place it in someone's mouth, in all the crooked teeth, they don't feel too much pressure, and gradually as the wire warms up, it exerts its pressure and works beautifully.
Well, that's awesome. You know, I remember when I first had to get glasses when I was a kid, I mean, I was ridiculed, you know, 4 eyes wearing the glasses. It was almost like a stigma to be wearing glasses when I was growing up. Now, it's cool to wear glasses. You know,
Sure.
I mean, there's no stigma at all. And the same thing when it comes to the braces. The children come into the office to see me, like when they have their braces. When look, I got my brand new braces, and
sure.
they're proud to show these braces off. Whereas, you know, it's no longer it's a rite of passage. And I saw the other day they had the school colors put into the braces, and they were proud the kids were proud to do that.
That has been a wonderful occurrence in I'd say the last 10 years is that children are sharing with one another enjoyment and looking forward to getting their braces, if they need them, of course. And one of the things that we've tried to move along with is different styles of braces that I'd mentioned, whether they're silver-colored stainless steel or gold-colored or even the clear for those who want to downplay the appearance. But these little colored ties that you were mentioning, the means, instead of using these stainless steel ligature wires like a twisty tie on a cellophane bag, we can now use little tiny rubber donuts that are latex and are very, very gentle and expandable to tie the wire into place, and the kids can choose different colors. So they can have fun, and that's the emphasis nowadays, that we like to have fun in what we're doing.
And is that like a shock absorber too? Is it like the pressure's applied, but it's not as abrupt?
Yes, that's a very good way of putting it. It actually, when a wire perhaps is a stiffer type that we're placing in a bracket and the tooth needs a little movement, we can either adjust the wire or apply this little ring that has an elastic force, and it can also help to move or rotate a tooth.
Can you elaborate a little bit about, I was reading in this study that says when you should bring your child to the orthodontist, a lot earlier than, originally I would have thought. Can you elaborate on that?
Yes, absolutely. Something, again, that has been an occurrence over the last, let's say the last 20 years or so in orthodontics, is becoming more and more popular, is an awareness that instead of waiting until a young person's teeth are fully adult teeth, all the baby teeth are gone. This is what traditionally dentists would wait and refer young people to the orthodontist when all the permanent teeth were in. Then what we had to do was look at how much crowding there was and decide what most often was decided then, about 15, 20 years ago, was routinely take 4 bicuspid teeth out. That was all we had to work with to make space and align teeth. We have looked at, in recent years, if we start a little bit earlier with young people, working with their growth, working with trying to reshape and help the form of the bone, of the arch, we call it the arch form that's actually supporting the teeth. If we work earlier, help try and modify that, can we do one of two things? Either offset the need for full braces entirely when all the permanent teeth come in, or if there is still a need when everything does come in, most of the time I've found in my practice doing phase 1 treatment, we don't have to extract bicuspid teeth when braces are needed, and the length of time that we put full braces on has reduced. Many times it's, instead of 2.5 years of treatment, we're looking at maybe 12 months of treatment with full braces.
Now, does that have long-term health implications as far as their periodontal health if you with that early intervention like that? Because if you can change the teeth earlier, does it make it so that as the gums are growing, as their facial structure is growing, that they may have better it doesn't take away from good hygiene, however, but I mean, just if the spacing's right, and you can, is there any studies or anything like that?
There are studies that are always looking at that, and I'd say one of the empiric things that I've seen in my practice and that share with other orthodontists as we see this, certainly as we align the teeth earlier and allow the gum tissue to take on a better shape and anatomy around the teeth, this is something that ultimately helps. The earlier that's done, the better the hygiene can be maintained and the better the health of the bone and the tissue as the child grows.
So it can almost be a cost savings measure over the long term.
Ultimately. And everyone, of course, is unique and different. And I'd say the bottom line, the usual thing that we see is an improvement. As you'd mentioned earlier, oral hygiene during the time the braces are on is imperative. The one thing that we do find that when we work with children is we emphasize the hygiene. It's important that they keep good hygiene. But anytime braces are put on the teeth, it's something foreign that's put in the mouth, and the tissues in the body has to adapt to it. But we find when we work earlier, the body is much more resilient and does very well to adapt to it, work with it, and adjust after the braces come off.
Right, it's just like changing it and stabilizing it right from the very get-go.
Absolutely.
Something that I've noticed is that there seems to be more and more adults getting braces on now.
Yes.
they're discontent with something that has been with them, the way that their tooth is shaped, the gap in between their tooth, or an eye tooth that's sticking out. I've never seen so many adults with with braces as I have now. And people in their 40s, 50s, going and doing, because they've always wanted to do that, and they're making that investment. Tell us a little bit about that part before we get over the medical need for braces.
You've said it very beautifully, that a lot of adults that come into the office that talk with me, and we always take time to listen. That's very important. It's something that I enjoy when I first meet a patient, listening to what brings them in and what are their thoughts, what are their feelings. There are a couple different reasons adults come in. One is they've always wanted braces. For whatever reason growing up, their parents either couldn't afford it or just wasn't an opportunity for them to have it, but they always had some feelings about their teeth. And as they've seen other friends...
Conscientious about...
Conscientious, yeah. Exactly. And as they've seen other colleagues or friends or someone at work come in with some braces, then they start thinking, gee, maybe I can do this too. Yeah. And what we like everyone to know is there is no age limit. I've had a patient, 68 years old, who just wanted to have certain teeth aligned and felt now was the time that they wanted to do it. My brother also is an orthodontist, and I think he holds the record. He had a lovely woman, 84 years old, who came in and had some teeth straightened out. So there is no age limit. The key is periodontal health. If someone has healthy gum tissue and good bone, and we get a good report from their dentist or periodontist that everything is healthy, then we certainly can proceed. I have seen some adults who come in, and it's been good they've come in. I've told them that, yes, we can help them, but the first step is to get back to their dentist, go through a good oral hygiene regimen, perhaps even see a periodontist, get certain areas taken care of, get everything stable and healthy, and then they can proceed with orthodontics.
Now, I've seen these clear braces that they wear now, these invisible line braces. Is that,
yes.
Is that the main application with the adults nowadays?
Well, a lot of adults come in asking for that. And Invisalign is the name of the appliance that's being used. And what Invisalign is, it differs from the standard bracket based appliance that we use in that it's a clear shell. I actually have a sample here to show you
let's take a look.
that this is a model of Invisalign appliances. When I hold this up at schools, when we talk at schools, and the kids all say, there's nothing on those teeth. And I mention, well, there is. And for people who have had any bleaching done on their teeth or who have had orthodontics with braces and have a retainer used, this is what the appliance looks like. It looks like a very clear plastic shell. And when it fits over the teeth like this, I tell the kids at schools, now you see it, now you don't. And the way that this appliance works is that this is just one of a series of appliances that are produced by the Invisalign Corporation. They produce it in their labs. And it is custom made to each individual patient and programmed so that the appliance itself, there's a series of these made, they are worn for 2 to 3 weeks at a time, taken off, a new set that is different from this one is then placed, and it alters the tooth or teeth a little bit at a time, similar to how braces work, but with a different application.
And that's is enhanced by the computer?
Yes. As a matter of fact, one thing that Invisalign has brought into orthodontics, which has really been terrific, has helped move us into this technological age that we're in, has been a way to visualize a treatment objective even before we get there. Orthodontic treatment planning has, for many years, incorporated the use of different X-ray views, doing tracings on X-rays, particularly the side of the head, a lateral head film it's called. And we've worked with population norms and standards of growth to try and predict where is this patient going to grow and how are we going to get there. It's been just that. It's adding a couple millimeters here and trying to imagine. With Invisalign, what they've done is using a technique that is referred to as ClinCheck, that is a computer-based program. They take impressions that we send in, they scan the impressions to get a three-dimensional image on the computer screen of that individual's teeth. I am able to, through the internet connection, look at that three-dimensional image and watch as, between myself and a technician at Invisalign, we actually move the teeth on the model into a final position. It's that actual visualized treatment objective that we see, like that little video, that the aligners are made based upon that, and then we get them back from Invisalign and give them to our patients about 3 at a time. So this is actually, I have it right here.
Very futuristic.
It's fabulous. It really is. This just gives you an example right here. This is an example of a patient who has their teeth already produced. I'm moving the cursor in that circle so you can see what I'm doing. I can grab hold of this model and actually turn it and look at it as if it were a three-dimensional plaster model in my hand. The beauty of this too is when I click on this little play button, I can now watch. If you look closely, you'll see the teeth moving and dropping into position. Those little red marks that you see aren't actually red in actuality, but they're little attachments that Invisalign utilizes in order to help certain teeth connect better with the aligners. But this is the state of the art that we're in now. This is a visualized treatment objective. I tell all my patients it's virtual, and we hope that by their using the aligners and their teeth moving as we would hope they would move, that we will achieve that. There are stages. If we're not getting quite there, we use other aligners to get there, but it really is terrific to have these tools to use.
How does this new digital imagery that you have in the office, this new equipment that's out, how does that help in your assessment? Is that involved with the this computer aspect, or how?
Yes, it ultimately is becoming more and more tied in, and I would predict in the next 2 or 3 years it will all be tied in. What we've done is, as you know, we are in our new facility, our new office on Prince Rogers Avenue, and I took the opportunity as we designed that from the ground up to not only have computers at every location in the office, at every chair and in every office, but we also placed a new state-of-the-art digital X-ray piece of equipment. This gives us a panoramic view digitally and a lateral head film digitally. The beauty of this is we need no darkroom in the office. We're not dealing with chemicals or developing film anymore. The image that we get on our computer screens once the machine does its movement is instantaneous. And it's clear, and there's
Cuts down on human error a lot. And
it absolutely does.
When it comes, because I know that's an issue when it comes to
temperature of developer fluid and the strength and all of that. Now we have these wonderful images to work with. And what I'm very excited about, as I say, in the next 2 to 3 years, is what is becoming all the more popular and important, and research is being done, is to take these images that we've used as one image of a panoramic set of all the teeth and one image of the side of the head, and we've mentally put these images together in our minds to come up with our diagnosis. Now more work is being done to take those images and put them together into a three-dimensional image that we can literally look at someone's skull and face on the screen, move it, look at it from different angles, and this is very exciting because it helps us sharpen our diagnosis all the more.
Yeah. With that digital imagery, I mean, let's talk about TMJ for a little while.
Sure.
Relatively common thing that brings the people in? I mean, separate from, moving the teeth and correcting the teeth? Is that?
Yes, it's something that I find, for the most part, patients who come in to see me have a concern or a question about their tooth position or the appearance or the function of their bite. As I do an exam of particularly my adults, we always do it on the children too, but their jaw joints normally, routinely work very, very smoothly. In adults, I find a number of things. I'll find, as I have them open and close, a little snapping or popping sometimes in the jaw joint. I always ask them, check the muscles, see are they experiencing any pain with that. A lot of times they say no, they're not experiencing any pain, but they've always had this little click. At least we determine, we know it's there, and we watch it through treatment. We don't want anything to become exacerbated, become any worse, but we monitor how they're doing. There are some patients who, when I do that, they say, well, now that you mention it, yes, every day I feel pain, or I feel soreness, or
they have headaches.
Always have headaches, or something going on here. Then I do a separate exam at that point and start evaluating the muscles a little bit more to get a feel for what is the relationship between, and that with a good medical history, is the relationship tooth related, or can the teeth have an influence on what they're feeling in the jaw joint, or did they come in saying, I have arthritis in every single joint of my body and I'm feeling this pain, then we know there may be a systemic concern. that's contributed to by the teeth but not particularly caused by it. Those who say everything else is fine, you know, I feel like I'm clenching or grinding all the time, then before we do any tooth movement, I utilize a special appliance called an SRS, or a splint, a superior repositioning splint is the long name for it, which is a modified kind of a retainer that just gets in between their teeth to help relax the muscles. It helps break up that feedback mechanism, the chain, exactly.
That cycle.
Yes, between the teeth and the brain, where to position the jaw. And once we get that relaxed, then we can determine a little more of what's going on for them.
When a person has proper alignment to their teeth, is there less tendency towards bruxism, you know, grinding or clenching the teeth, than when their teeth aren't in alignment? Or is that strictly a neurological thing? I mean, what's your comment?
Well, you've asked a really good, excellent question that I'll do best to give you an answer to from what my experience has been seeing patients. There are some people who come in with this kind of a bite, and we would call this an ideal class 1 bite. This is textbook. This is what we'd love to see. Some of these people have come in with one little tooth turn. They come to see me, can we fix it? But they have the worst pain TMJ problems that you can imagine because of something that we have to ascertain. Other people come in with 2 or 3 teeth touching. Their joint feels fine and they have no consideration. So we have the opposite end of the spectrum. There are a number of people, though, who come in with teeth askew, not meeting correctly, with cross bites, where their jaw is trying to get the teeth together properly and they're having muscle spasm, and they also have this TMD or TMJ problems.
It's kind of like a cow chewing the cud,
exactly.
You know, trying to get it to work right. Huh?
That's right. And to the degree that we find that yes, tooth position has an influence on that, we try to help that to minimize it. There are some people that when we do get their teeth apart, get the muscles relaxed, they feel much better. And I give them the choice. You can either keep wearing the splint nighttime to help offset any grinding they're feeling, or you can take the next step and try to align your teeth and see if that gives you a more permanent result. There's another option where, as you'd mentioned, bruxing, grinding of the teeth. Simply, if the teeth aren't meeting, that can stimulate some grinding. But there's also, I've found, a congenital aspect. Some children with good-looking, well-aligned teeth grind like crazy. And I talk to the parents. They say, they're grinders. They always grind. So there's many, it's a multifaceted situation.
Yeah.
We always have to look individually, what is the individual's concern and what is their
the stress thing, or, you know,
exactly.
that type of thing.
That plays into it too.
You know, I've read that 50% of all of the calcium that comes in and out of your body, that goes from storage form to what we use, is stored in the jaw joint, stored in the mandible. Is that, you know, and that's due to bone forms to stress and just the amount of pressure that our teeth. How many pounds per square inch do we get?
Well,
a lot of.
We get a lot of pressure. The masseter muscles, and in fact, I've been accused of this by my staff when they look at me sometimes at a meeting, that they notice, you might notice this in someone, you can see when they're grinding, these muscles bulge out quite a bit. These are extremely strong muscles, along with the muscles along the side of the head that close. We can develop tremendous pressure with our teeth, and the bone is extremely dynamic, as you well know. The skeletal system is constantly fluxing depending on our weight, depending on our strength, our muscles. There's always a dynamic response in the bone, and we see the same thing in the mouth, around the teeth.
I've seen studies that they've done where people have had their teeth extracted for, you know, one reason or another, and that to get dentures, and then they don't wear them right. How much shrinkage that they get of their actual facial structure and jaw bone in a short period of time.
Absolutely.
So I mean, it's just a classic example of physiology and the dynamics.
It is.
Pays to keep your teeth healthy. That's for sure.
Absolutely.
Don't take care of them and they'll go away. You know, that right. Aspect.
That's right.
We're coming towards the end. Is there some additional messages that you want to put across? We've got about 3 minutes left to our program here.
I would just say the questions you've asked today have been really excellent to cover a lot of the area of orthodontics. Orthodontics today, and what we work very hard in our office to do, is to make it a fun experience for all who come in, the kids and the adults. We're doing something very important. We're aligning teeth. We're giving them good oral health, good functioning of their bite, as well as improving the aesthetics of their smile. And it's hard to put a little pin on exactly what the effect of that is, but we know in the experience of kids coming back, adults coming back and telling us their stories of interviews and jobs and areas in which their smile has helped them out. It's a life-changing kind of thing that can occur that we work with. And I'm very excited about it. I love what I do. And every day, I really do. I don't want that to sound corny. I love it. I love going to work and being able to do what we do. And I'm excited that in this field, it's constantly changing and improving. One little area is we're working out mechanics in orthodontics that have always been a bugaboo for us to try and hold teeth in a certain position while we're moving others. Now, with the implants that are being used in dentistry, we're working with mini implants that can help us, very simply placed and utilized, help us improve our mechanics. So we're getting even better as we go. And with Invisalign and the techniques of bonding, it's a very enjoyable, it's a wonderful career to have. I love it.
A few things that I'd like to have demystified is that somebody was telling me the other day, when you're younger and you smile, the tendency to have your upper front teeth when you're younger is great. And as you get older, when you smile, you know, your normal smiles, people are seeing more of your lower teeth. Was that just a...
That's a very interesting question. I haven't seen that progressively in one individual. But I think that has a little more to do with jaw structure. There are some people, when they smile, you see more of their lower teeth, because of the relationship of their jaws or the amount of bone they have in their upper jaw. And there are others who, when they smile, you see their upper teeth. But that's a very good question.
It's not like a gravity thing going on.
No, it isn't. No.
Now, how about this? I mean, I tell you, it's tough to demystify all of the dental care products that are out there. I switched to using an ultrasonic toothbrush, and I'm very happy with it because it makes my teeth feel like the way that it does after I get out of having a professional cleaning done to my teeth. But they have, I mean, soft bristles.
Yes, absolutely.
Got to go with soft bristles.
Absolutely. Anything you use has to have soft bristles.
Okay, because I was, from growing up until recently, regretfully, is that hard, gonna get in there. I'm gonna make some action go with the hard bristles. I don't even think they sell the hard bristles anymore.
Well, they do, unfortunately. Some supermarkets do, but a lot of adults similarly come in, and the key is soft, gentle motions with a soft bristled brush, and you can do a really good, thorough job. You do not have to scrub. You can actually make notches in your teeth doing that, and I've seen a few adults come in with that.
Dr. Sanford,
thank you very much.
Thank you for coming on the show. That was very informative. For Natural Healthcare Alternative, I'm Dr. James R. Golding, and thanks for watching.